Living with diabetes comes with its own set of challenges, particularly when it comes to maintaining the health of your legs and feet. Aching and discomfort in these areas are common, but there are effective strategies you can adopt to manage and relieve these issues. In today's video, we will explore practical ways to deal with aching diabetic legs and feet, focusing on strategies you can incorporate into your daily routine. First, it's crucial to understand why diabetes can lead to aching legs and feet. Diabetic neuropathy, a type of nerve damage caused by high blood sugar levels, is often the culprit. This can result in pain, tingling, or a sensation of heaviness in your limbs. Reduced blood circulation to the legs and feet can also exacerbate these symptoms, making it essential to prioritize good circulation and nerve health. Let's start with some basic practices. Ensuring your blood sugar levels are well controlled is fundamental. Maintain a balanced diet, exercise regularly, and adhere to any medication guidelines your healthcare provider prescribes. These steps not only help manage diabetes, but can also alleviate some of the leg and foot discomfort associated with the condition. Footwear is another critical aspect to consider. Choose shoes that offer ample support and cushioning while avoiding tight or restrictive footwear. Properly fitting shoes can significantly reduce the strain on your feet and lessen pain. Additionally, wearing diabetic socks, compression socks, which are designed to minimize pressure and enhance circulation, can be beneficial. Incorporating specific exercises into your routine can help too. Simple leg and foot exercises, such as calf raises, ankle circles, and gentle stretching, can improve blood flow and reduce stiffness. Regular physical activity sends more oxygen-rich blood to your extremities, alleviating discomfort and promoting overall foot health. Massage and warm baths can provide immediate relief for aching legs and feet. Massaging your feet with a moisturizing cream not only soothes tired muscles, but also keeps your skin healthy and hydrated. Warm foot bath, infused with Epsom salts, can also enhance circulation and provide much-needed relaxation. Moreover, maintaining a good skincare regimen is essential. Inspect your feet daily for any signs of blisters, cuts, or calluses. If you notice any concerning changes, seek medical advice promptly to prevent infections or conditions from worsening. Keeping your skin moisturized will prevent cracking and further discomfort. Finally, it's important to regularly consult with your healthcare provider. Regular checkups allow for the early detection and treatment of potential complications. Your doctor may recommend additional therapies, such as physical therapy, or prescribe medication to manage pain and improve your quality of life. In conclusion, managing aching diabetic legs and feet involves a multifaceted approach. By controlling blood sugar levels, choosing appropriate footwear, exercising, and maintaining a good skincare routine, you can significantly enhance your comfort and well-being. Remember, regular medical consultations are key to staying on top of your health. Thank you for watching, and take care of your health. Please like and subscribe for more informative videos.